female delivery, some people will have this psychosis conditions and delusional disorders. So these are all coming under psychosis conditions. Earlier we discussed about neurosis. Neurosis means somewhat mild condition like stress, depression, and anxiety. In neurosis, the person knows what is happening to him. The reality he can understood. But coming to psychosis, the person feeling schizophrenia, bipolar, and delusional disorders, they don't understand the reality. Out of reality, they think. That is the difference between neurosis and psychosis. Generally, how these symptoms, the psychosis, see, mental illness is related to psychosis only. For example, in Hyderabad, there is a mental health institute is there, mental health hospital. We call it Yerragada Hospital. There, most of the patients will come psychologically disturbed people only. The neurosis condition people only, most of the people will come and approach in that hospital. Generally, a person is feeling more depression, stress, anxiety. Those people will come to most of the time to psychologist. And the psychosis people will go and approach a psychiatrist. But it is a team spirit working between psychologist and psychiatrist. So there are two different conditions like neurosis and psychosis. As a psychologist, everybody should understand the difference between neurotic conditions and psychotic conditions. That is the reason before entering into our topic, I am explaining these conditions. So today, our topic is schizophrenia. See, this I told you earlier also, as per Mental Health Act, there is a separate act for the psychotics symptoms related disorders. There is a separate Mental Health Act 2017. There is a separate act. And disabilities, there is a separate act. The professionals, how they have to follow in day-to-day in their clinical setting, Government of India has formulated one act that is called Mental Health Act 2017. Suppose if any clinical psychologist, the clinical psychology related studying people, before going to practice, they have to understand the Mental Health Act. That act will decide how they have to proceed in their practice with the clients. That is very, very important. So, schizophrenia. Schizophrenia is a Greek word. Schizophrenia means, schizo means split. Split, that means two type splitting. Schizophrenia means split mind. Split mind. The name of the schizophrenia, as per Greek, it is split mind. It is very serious mental health condition. The schizophrenia will affect how people are thinking and how people are feeling and how they are behaving. So it will have effect on thinking process, the feeling process, and behaving process. All these three areas, these mental health conditions will create some effect. So these people, particularly the psychosis people or schizophrenia affected people, they will have some hallucinations, delusions, and their thinking is very disorganized, and behavior also very odd behavior. These are all the main symptoms of schizophrenic patient. Once again, I will say, schizophrenia is a serious mental health condition. It will affect the person's thinking process, how they are feeling, and how they are behaving. These three areas, the schizophrenia will affect. And these people will have hallucinations. I will explain you what is hallucinations and delusions. And their thinking is very disorganized, and their behavior is also abnormal. It is not normal. It is away from very normal behavior. These are the symptoms and signs we can observe from a psychosis patient or schizophrenia patient. I am audible now? I am audible?
Yes, sir, but I have a doubt. So the psychosis patients are not aware of their mental state.
Yes.
Okay,
Yes.
thank you.
They don't understand the reality means same meaning, na? Okay.
Yes.
And the schizophrenia, how many people are having? How it is affecting the people? Suppose if you take 100 people, 1 person or 2 persons, maximum 2% people are affected. The prevalence of schizophrenia in the society is 1 to 2% only. But it should be impacting the society and family also. And how this is getting developed? Schizophrenia, that means mental illness, how it is getting developed in the persons. The schizophrenia will affect from childhood onwards. Not only it will affect the elders, that means the adults, not like that. The schizophrenia will have, it will cause from the childhood onwards. But the symptoms are mild. The observable symptoms are limited. Once they come to some adulthood, the symptoms will very visible. Even in childhood also, we can observe some physical abnormalities and their motor coordination, the body movement coordinations, and how they are thinking, because we discussed their thinking is very disorganized thinking, we told, in mental illness people. But in childhood also, if you observe clearly, their thinking pattern is somewhat disorganized. And they will have, because of this disorganized thinking, they will have some social problems also. But in childhood, people will not give that much importance to this. It is happening because of the child immaturity, like that. Earlier stage, people will think like that. But once they become adulthood, once their age level increases, the symptoms are clearly developed and clearly visible also. In that age, the diagnosis is also somewhat easy. So, psychosis is a serious mental health condition. The people, those who are affected with psychosis or schizophrenia, they are away from, most of the time, they are away from reality. Their functioning is abnormal. Their thinking pattern is abnormal. Their behavior is abnormal. So we can imagine how the society will understand the person who is having the mental health issues. So any doubts so far?
No, sir.
Okay.
సార్
Okay.
ఈ సైకోసిస్ అనేవి లక్షణాలు పైకి కనపడతాయి కదా సార్, ఇట్ ఈస్ విజిబుల్.
Yes,
యాజ్ అండ్ వెన్ వీఆర్ సీయింగ్ ఎట్ వన్ పర్సన్ వీ కెన్ ఐడెంటిఫై ది.
yes, psychosis conditions, other people definitely will understood.
ఎస్
But the person who got affected, he cannot understood. That is the problem here.
ఎస్ సార్, ఎస్ సార్. అండ్
They
మోర్
deny.
దట్ ఇట్ విల్ బి ఆన్ పర్సంటేజ్ బేస్.
It is 1 or 2% only.
ఓకే.
In the people. The person who got affected, he will not accept his conditions.
ఓకే.
Because the reality he is missing.
అండ్ వాట్ కైండ్ ఆఫ్ సిమ్టమ్స్ విల్ కమ్స్ అండర్ దిస్ సార్?
How is the symptoms you are asking?
ఎస్ ఎస్, వాట్ కైండ్ ఆఫ్ సిమ్టమ్స్ వీ కెన్
Okay.
కన్సిడర్ ఇట్?
For that symptoms understanding, you should know about hallucinations. What is hallucinations?
Okay.
What is delusions? If you understand the meaning of hallucinations and delusions, and definitely you know what is mental illness. I will explain you.
ఓకే సార్.
So people with psychosis experience some delusions. Delusions means false beliefs. Delusion means false belief. They think the delusions means, I will give one example also. The person will understood by seeing the television. Suppose the person is seeing television, he thinks the television is giving some special messages to me. Okay. And he thinks when nobody is trying to hurt him also, but he thinks surrounding my people are trying to hurt me. They are planning to kill me. They are planning to make some damage to me. These are all delusional way of thinking. And I say hallucinations, how hallucinations will be. These people will hear or see certain things which other people are not noticing. Hallucination means he says, somebody is scolding me. Somebody is talking against to me. He is in the house or he is in the one place. He talks like this. Surrounding my people are scolding me. They are planning to poison us my food. Other people are not noticing anything, but he only noticing. Actually, it is not real. That is the reason I told you that these people are away from reality. So these people will have delusions, that means false beliefs and hallucinations. Hallucination about seeing and hearing, both, which is not there also. Even when they are in the house, outside some people gathered to kill me. My neighbors are talking against me. These are all his beliefs, his imaginations, but it is not real. Now you understood, Pawan?
Sir.
Pawan,
Yes,
you
sir.
understood
Yes, sir. Understood.
how the delusions, how the hallucinations.
Yes, sir.
One question here. So this hallucination and delusionation will be with them like 24 hours, or will it be on and off, like coming and going?
Almost one psychosis affected means it is a continuous for him. There is no on and off. Is
Okay.
because that is the reason we said it is very disordered thinking.
And most of the time, those people have a nature of suspected manner.
Yes, yes, I am going to come to that.
Yes.
సార్ సార్
Ah,
సార్ ADHD చిల్డ్రన్స్ ఒక దగ్గర కూర్చోలేరు 2 మినిట్స్ కూడా. వాళ్ళు ఎక్కువసేపు ఉండలేరు అని అన్నారు కదా! మరి వీళ్ళ బిహేవియర్, వీళ్ళ అలవాట్లు కూడా అలాగే ఉంటాయా?
ADHD ki psychosis ki there is no relation at all, because ADHD అనేది they
Sir.
know what they are doing.
సార్
The reality they know, but
Okay.
here these people,
సార్
they don't know the reality. See, by sitting in his house, he is
Sir.
saying, my neighbors are planning to kill me. Is it real?
నో సార్, ఇట్స్ నాట్
It
రియల్.
is not real.
సార్
Correct, na?
సార్
Some people, my neighbors are talking against me,
సార్
and my neighbors are planning to make poisonous my food.
సార్
It is not real, na?
ఎస్ సార్.
So this person thinking against the reality. He himself feel my thinking is correct.
సార్
He is away from reality.
సార్
This is called psychosis conditions.
ఓకే సార్.
And he is having false beliefs.
సార్
He is having hallucinations.
సార్
And his behavior also, according to thinking, his behavior also change. Suppose somebody is trying to kill me. The neighbors are trying to kill me. They are making plans to kill me today night.
సార్
What he do? Without the neighbors are not at all trying to kill him.
సార్
He prepared the actions also. They are trying to kill me, so I should be prepared. He will keep a axe with him or knife with him, or something he will arrange.
సార్
So in a family, the family members, how they think, nothing is there. Neighbors are very friendly to us. Why this person is thinking like this? Why he is behaving like this? After thinking, his behavior also changed. So it is very bizarre behavior, very disorganized thinking.
ఓకే సార్.
So these are all the psychosis conditions, schizophrenia conditions.
ఓకే సార్.
So these persons in the society only 1 or 2% people are available. The causes for this is family disruptions, highly stressing conditions, highly depressive conditions. If they don't treat in time all these conditions, those conditions, the pressurized conditions, will turn into psychosis. Initially, those conditions are neurotic only. But slowly, those conditions will lead to psychosis conditions. Now I am going to explain the psychosis, schizophrenia symptoms, how it will be. Okay?
Okay.
These people are more suspicious. When a person sitting in his own house and he is telling, my neighbors are planning to kill me, it is a suspicion only, na? So these people will have more suspiciousness on others. And they have paranoid ideas. Paranoid means that is also part of suspicion. Most of the time they think everything paranoid, everything suspicious. Because of this suspiciousness, they don't maintain good relations with others. Because when you are suspecting somebody, definitely we don't maintain with others. The behavior is not so easy with us. We don't have easiness with others in that condition. And the person misses logical thinking here. His thinking is not logical. And the person thinking in a disorder manner, he don't mix with social people. Socially, he will withdraw. Most of the time, he spend alone. And his ideas, to face that conditions, his ideas are very intense. He will fully prepare to attack. When somebody comes from outside to kill him, nobody is going to come. He is only imagining. He is only thinking. But even though people are not coming to kill him, he is fully prepared. If somebody is coming like that by imagining, he will make his preparations. While sleeping also, he will keep a big knife in his bed. Is it a normal condition? Is it abnormal behavior?
Abnormal behavior.
Yes. This is the psychological illness. And these people, they don't bother about their self-care. That means hygiene conditions they don't maintain. And they don't have proper sleep also. Their sleep time is very less. Most of the time, they are in fantasy. They are not in reality. And their speech also, very confusing speech. So you can imagine this type of people, if they are working in an office, how their performance also. Just we can imagine.
So do they harm others and self?
Definitely.
Okay. They are
Definitely.
dangerous. Okay, thank you.
See how they harm, you know. Suppose somebody walking in their road. He is having already suspicion. Those persons are trying to harm me. He is fully prepared to face that harm. Okay. So if the persons moving in front of the house or going on in front of the house on the road, he will try to attack them. He will try to scold. He talk rubbish. This is a harm na, for the family and for himself.
Yes.
So psychosis is a very serious condition. It should be compulsory attended, and family members also unable to adjust. They will have a lot of suffering with that person.
Will they harm themselves, sir, in any situation? Will they try to kill themselves or harm themselves?
You are seeing now in US what is happening in schools and other areas.
Yeah.
Massive killings. Why they are doing? We are seeing now.
Yes, sir.
But instead of killing themselves, they try to attack others most of the time.
So those
Okay.
people will not prefer for suicides. Am I right, sir?
See, generally the depressing people, there is a chance of suicide also. Generally, finally, the depression leads to suicide only.
Okay.
So,
Sir, is it inherited?
Amma,
Is it inherited?
is it?
Inherited?
I'm not listening clearly. What you are?
Inheritance. Like
Yeah. Definitely. Some genetical inheritance is there. అందుకనే కదా, when we go for a marriage, we are not only looking the boy or girl, we are seeing their family, not only wealth, and their family conditions also we will see. How is their family people, their health conditions, how is their grandfather, how is the mother. So either mother, father or grandfathers are having some the psychological illness conditions, there is a chance to develop in the coming generations also. Not compulsory, but there is a risk. Clear?
yes, sir.
Okay.
Yes, sir.
Okay. And I will explain you in schizophrenia about hallucinations. Hallucinations where a person sees, hears, smells, or feels that no one else can see, hear, smell, and feel. Nobody is smelling, nobody is hearing, nobody is seeing, but this person only seeing. Even though nothing is there, but this person is seeing. These are all the most common type of visual hallucinations. Hallucinations will come in visual and auditory, both. Just by sitting in the house, his wife is there in the kitchen room. She is talking against to me. Nothing she is talking. But he is having that hallucination. She is criticizing me. She is talking against me. I am hearing clearly. He says like that, I am hearing clearly. But that is not real. She is not talking anything. She is very silent. She is working on her work. But he is saying she is talking. I am hearing. I am seeing. Like that he talks. So the hallucinations are this type of conditions. Particularly hallucinations are hearing and seeing. These two areas, much it will affect. In schizophrenia, many people with the disorder hear voices. The voices may talk to the person about his behavior. Sometimes the voices ఎలా ఉంటాయంటే, they are ordering me to do this thing. somebody is ordering me to do this, to behave like this. The person is not there. He is not ordering, but he is saying they are ordering me.
Sir,
Who is ordering?
do they confirm by saying that they are ordering me to do this thing?
Actually, it is not there. Really, it is not there. Really, it is. He is not missing the real. He is missing the reality, which is not there. But he is telling, which he has not seen. He is saying, I have seen. Which he is not hearing. He is saying, I am hearing. There is no reality.
No, she mean to ask, will they tell that I'm doing this because someone is telling me, I can hear someone's voice so that I'm doing this action? Will they claim that they are doing it because someone's saying?
Yes, yes, yes.
Because I have one in my family, so that's what I'm asking about that. So do they claim that, sir? Because we never heard that she is claiming that such type of thing, that someone is going to say these things to me.
See, unless we take the person, we see the person, we take deep interview from the person, we cannot assume this person may have like this. Please don't assume these conditions to every context. Okay? Just by seeing one condition, don't assume what I am saying. See, there is a ICD, there is a DSM, there are certain criteria. Before deciding anything, before diagnosing anything, we have to follow the conditions what they lied in DSM or ICD. Those conditions are having this person, means then only we come to a diagnosis. Just because of one area. See, some people, emotionally disturbed people also, temporarily they behave like this. But we cannot say he is having psychosis. There is a time period. There are some...
Curable?
Huh?
Is this curable? We can cure through medicines or medications?
Yes, definitely. For that purpose only mental health hospitals are there.
Sir, after the breakup, some people used to do this like this. They feel this kind of hallucinations or this thing. So can we consider or relate with this, or that's something else that's separate?
See, you are all initial stage of hearing this type of conditions. See, having that much anxiety is very normal to know very clearly. See, these are all mental ill health conditions. Unless we have thorough observation, we cannot come to any conclusion. That is very, very important. So please mute now. Somebody is disturbing. Hema. Hema. Okay.
Sir, what is the difference between hallucination and delusion? Suppose if you have said somebody is saying that ordering me to do a thing, so that hearing some voice is hallucination and doing that or feeling that is delusion, sir?
No, delusions people will have some grandiose also.
Okay.
I know
So
everything.
Sorry, sir.
No, both are different conditions.
No, both will not be there in a single person, sir. Like the same person will be experiencing both the hallucination and delusion,
Yes.
or only one type?
Both they will experience according to their seriousness of the condition. See, okay, there are mild conditions, moderate conditions, and severe conditions. See, the mild conditions will not much affect the functioning of the person or the family persons also. But the person having severe schizophrenic conditions means Definitely his function is very bad. And the family members also will have a lot of problems to adjust with him.
No,
Okay.
what I want is what is the actual differentiation between a hallucination and a delusion, sir? Like, how can I differentiate? Hallucination is hearing or seeing something which is not occurring, hearing something which is not there.
Hearing, seeing, smelling, feeling, all these things will be there in hallucinations. But without, really that thing is not there.
Sir, but in delusions, you have said that from a TV, somebody is giving something, giving some message to me or saying something to me. That will also be under a hallucination only, no, sir, which is not there and which that person is hearing.
I will explain you about delusions also.
Okay, sir.
See, తినబోతూ ఎందుకు రుచి గురించండి. Please have some patience.
Okay, sir.
And coming to delusions, how the delusions person will behave. Try to listen carefully. Delusions are false beliefs. The person believes delusions even after other people prove that the beliefs are not true or logical. People with schizophrenia can have delusions that seem bizarre, such as believing that neighbors can control their behavior with magnetic waves. They may also believe that people on television are directing special messages to them. That radio stations are broadcasting their thoughts aloud to others. Sometimes they believe they are someone else, such as a famous historical figure. I am very close to Narendra Modi. Just now, I talked to him. I am very close to Narendra Modi. Just now, I spoke to him. This is the best example for delusions. They may have paranoid delusions and believe that others are trying to harm them, such as by cheating, harassing, poisoning, and spying on, or plotting against them or the people they care about. These beliefs are called delusions of persecution. The delusional behavior is the example what I said. I know Narendra Modi very well. Just now I spoke to him. One way, the grandiose, which is not possible to him for an ordinary person. He is having this type of wrong beliefs, false beliefs. By talking like this, he tried to convince other people. The family members knows now his position, what connection he is having, Mr. Narendra Modi. Is there any chance Narendra Modi can call to him? I am a very famous person. Like that, the delusional things will happen. One way of this is disordered thinking also. Amma, nee doubt clear ayinda talli?
Sir, yes, sir. But it's more of sensory process. Ante kada sir,
yes,
mana
yes.
hallucinations ante sensory process. This is thought process.
Yes, yes.
Totally.
There is some difference between definitely hallucinations and delusions. So we are discussing the psychosis persons. Psychosis conditions, so many disorders are there. One of the condition is schizophrenia. These people will have delusions. These people will have hallucinations and thought disorder problems. Even movement disorder also is there for them. Schizophrenia people, movement disorders. That we will discuss in next time.
Yes.
So we are going to now discuss about thought disorders, how these people thoughts will be. Okay. Thought disorders are unusual or dysfunctional way of thinking. One form of thought disorder is called disorganized thinking. The dysfunctional or unusual thought process we call as disorganized thinking. The thinking process is not properly organized. See, these people, the way of speech also is not proper. Meaningless speech, sometimes they talk. And one more example I will say in thought disorders. Where a person stops speaking abruptly in the middle of a thought. Suddenly they are talking something. Suddenly they stop what they are talking also. When asked why he stopped talking, the person may say that it felt as if the thought had been taken out from his head. The thought has gone from my head. It was taken out. See, when we are discussing some topic, suddenly stopping the topic has gone from my head out. We will ask, let us continue the topic. He said, the topic has gone from my mind, from my head. So these are all the thought disorders. Suddenly stopping, suddenly disappearing the conversation, suddenly stopping the thoughts. Even if we ask to continue the thought, he says it has gone out. So this is not order of thinking, no? His thought process is not organized properly, very disorganized. And his speech also very meaningless sometimes. He uses very meaningless words he uses. Because his thought process is not order, he cannot continue any conversation. Suddenly he stops. He says simply, the thinking process has gone from my mind. I can't talk anything now. Any doubt, Amma? Vasavi garu?
Sir, no, sir.
Okay. Now, what are the conditions so far we discussed about this psychosis people behaviors? One is hallucinations. Second one is delusions.
Delusion.
Thought disorders.
Thought disorders.
Thought disorders.
So, okay. There is a difference between delusion and illusion. Illusion is entirely different. That is reality only. It is wrongly perceiving. Illusion is a different thing. Oka తాడును చూసి పాము అనుకోవటం is a illusion. భ్రమించటం. Just we misperception. So here the person is having hallucinations, delusions, and disordered thinking, and movement disorders also. The schizophrenia person, they don't maintain neatness. Hygienic conditions they don't maintain. A person with a movement disorder may repeat certain motions over and over. Their body movements also, they maintain some repeated movements. Catatonic, one condition is in schizophrenia is catatonic. Catatonic ante ela untundante, he is on the bed, he is like a ball, round type ga, just he close all his hands and legs, just a closed ball laga, he sleeps on the bed. బాగా ముడుచుకుని పడుకుంటారు. A person placed on the bed is like a ball ante you can imagine. That is catatonic schizophrenia conditions will have that type of things. But in schizophrenia, there are different types of schizophrenia is there. Again, now we discussed only the symptoms of the schizophrenia, how the schizophrenic person will have different types of symptoms like hallucination, delusionation, disordered thinking, and movement disorder also. These are all the clinical picture. Clinically, how we can see those people. And this schizophrenia is having different types. In our book also it is there. Schizophrenia is having 4 or 5 types. Based on their symptoms, schizophrenia made division into 4 or 5 types. The first one is paranoid schizophrenia. Paranoid means more suspiciousness. The second one is catatonic schizophrenia. The third one is hebephrenic schizophrenia. Fourth one is simple schizophrenia. The fifth one is undifferentiated schizophrenia. So these are all the different types in schizophrenia. Anybody has seen the schizophrenic patients? Anybody?
Yes, sir. I had an aunt. Yes, sir. I had an aunt and an ex-colleague who I had an aunt and an ex-colleague who used to say, like, you know, somebody is scheming to kill me and my mother. And my ex-colleague, she was quite young, but she ran away from the house, saying that somebody from her across the street has implanted a chip in her brain and they are ordering her to kill her mother. So, and also saying that they will kill her mother. So she ran away from the house. For 2 days, she was out of the house and there was a lot of panic. There's one case, and I had another aunt who was old and she had these auditory as well as visual hallucinations, saying that somebody was trying to kill her all the time. As you said, she did not have sleep. She did not let others sleep in the night, continuously talking and saying somebody's, you know, they're trying to come and kill me. Trying to rob things from my house and all those things. For almost 5 to 7 years, she suffered from that condition, sir.
Now, how is she?
She died. And I don't know about the ex-colleague because I lost in touch with her. Somehow she came back home because someone helped her. They found her in Bangalore in the bus station. And that chap, he put her in a bus and then made her go to the house. So after she reached home, her mother called me and said she is back at home. Luckily, she was safe and nothing happened to her. But later on, I lost in touch with her. I tried to take her to a doctor also because I understood that she was having the schizophrenic symptoms. Saying that people are trying to kill me, they're trying to poison me and ordering me all these things.
So the prevalence
because,
is
luckily,
the prevalence in the society is 1% to 2%. This type
Even
of condition.
my mother-in-law is a schizophrenic patient, sir.
Okay, Namma, please don't be in common group personalized issues.
No, sir. I'm telling, have you seen any person? And my mother-in-law is a schizophrenic patient, sir. Since 40
Okay.
years, she's a schizophrenic patient, and we have been giving her medications, and she's taking the medicines. That's it.
Definitely,
No problem,
good
sir.
thing.
Yeah. Okay, sir.
And if anybody is having interest to go for this mental illness treatments and all these things, studies and all, you have to study clinical psychology.
Yes, sir.
Clinical psychology only talk about all these things. So if you are not interested in doing mental health issues or mental illness things, some people may not like this. Some people may like only child activities. Some people may like about family counseling areas. It depends on the student passion.
Yes, sir. So after this MSc, we can do clinical psychology.
Yeah, you can do it.
Okay. But we don't have it in Hyderabad, do we?
It is there, Thakur Hariprasad College in Hyderabad.
Okay, sir. Thank you.
Is it available in distance mode, sir?
No. See, higher education is not at all available in distance mode because you need some practicum experience exposure daily when you are studying clinical psychology or rehab psychology or any other psychology. It is a research oriented and practicum exposure.
Yes,
and
sir.
having some study material also.
Practically,
So
we learn more.
yeah, you are interested means you can inquire about the details.
Can I repeat the college name, sir? Sorry.
Thakur Hariprasad.
Thakur Hariprasad. Okay, sir.
Where
Okay.
is this, sir? In Hyderabad?
You can Google it, Amma. I will get everything address, all this.
Dilsukh Nagar.
It is a Vivekanand Nagar. This near Dilsukh Nagar, sir.
Okay.
Is there any entrance for that, sir?
Definitely. After MSc, any qualification you want to go for means you must attend for entrance examination. And now we will go for these types of schizophrenia. In your book also, they given all these conditions. The first condition is paranoid. Even paranoid, there is a personality disorder also. Paranoid personality disorder. Here, we are discussing about paranoid schizophrenia. These onsetting schizophrenic conditions, once again, I want to say, if the knowledge people clearly observe from childhood, they can notice some clinical picture of the person. But normal people will not have this type of knowledge, no? Only clinical people will have knowledge. That is the reason identifying at childhood level. Childhood means at 8-10 years age or teenage level. But identification is somewhat difficult because of lack of understanding. Once they come to some higher age, that means at least adulthood, the abnormal behaviors clearly visible. The delusions or hallucinations are clearly visible. So that time definitely they will go and approach one clinical psychologist for the assessment and having treatment. So paranoid schizophrenia people, they will have more suspiciousness. We are discussing now how the suspicious means. The neighbors are planning like this. They are trying to kill me. They are planning to poisonous my food. Like that. These are all paranoid. Paranoid means suspiciousness. And Why they divided these type of schizophrenia in different types means certain conditions they have very intense. Suppose in the schizophrenic person, the suspiciousness is so intense, they divided that condition into schizophrenia, suspiciousness. That means paranoid schizophrenia. According to the intensity of the condition, they made divisions. Somebody is having related to body movement. He is having schizophrenia, but extra he is having is body movement problems. That has come into catatonic schizophrenia. Anyhow, schizophrenia is a very problematic one. Adjusting with schizophrenia is very, very difficult. And another condition is hebephrenic schizophrenia. These people tend to have an earlier onset than the other subtypes. The hebephrenic schizophrenia, the onset means the developing conditions is somewhat earlier than other types. Suppose all the schizophrenia people will have hallucinations, delusions, and disordered thinking. But these hebephrenic schizophrenia conditions are somewhat early noticeable out of all the 5 conditions. These people behavior is very childish and silliness, and senselessly their behavior looks like senseless, and their behavior is almost, they don't have any purpose with their behavior also, like that they behave. And meaningless laughing also we can observe self-laughing. You heard about self-laughing. People sometimes on their self, without any reason, they laugh. So these are all the hebephrenic schizophrenia conditions. So one way is paranoid schizophrenia, catatonic schizophrenia, hebephrenic schizophrenia, and simple schizophrenia.
So, sir, schizophrenia can be seen in children also?
Can be seen if you are having some knowledge about schizophrenia. They wrongly assume these are all the other conditions.
Because I have a MR client and an ADHD client, but they have excessive laughing.
Self-laughing.
Yes, sir.
So is there any trigger for their laughing? Is there any stimulus?
Like when they get excited or when they just think something in their mind probably, and suddenly they're mostly almost laughing only. Between the activities, between the therapies also. And the parents also complain for no reason, they keep laughing.
See, some autistic children also will have some excessive emotions. See, laughing comes under one way of emotion only.
Yes, sir. But these are ADHD and MR clients.
Okay, definitely MR clients means less intellectuals.
Yes, sir. Mentally retarded.
So mentally retarded. They don't know how to behave, first thing.
Yes, sir.
They don't have control on their emotions also. So we cannot say that is the condition of schizophrenia, because low intellectual people will have sometimes, they show more anger, emotional only, they laugh much. That is a symptom of mental retardation.
Okay, sir. An ADHD person, I'm little confused because they have just done this basic cars, reels and all. assessments. So if
see, ADHD is a different condition. They have more inattention. They have hyper conditions.
yes, sir.
And they have impulsivity conditions also.
Yes, anxious. They're very anxious also.
And the low IQ people, that means the retardation people, mentally retardation people, sometimes their functioning looks like ADHD because uncontrolled behavior, uncontrolled laughing, suppose. Okay, uncontrolled anger. See, it looks like sometimes they are having very hyperactivities, that is, they're doing like that. But normally, low IQ people, they don't have self-control. They don't have control on their actions. Some exaggerated emotions they will show sometimes.
So there is no treatment for such things, sir.
Which one?
For MR, they just learn to deal with their life.
And in MR also depending on their severity. Normally in MR, there are 4 stages: mild, moderate, severe, and profound. So we can improve their daily functioning up to mild level. Mild level.
Okay.
If the persons are at moderate level, the daily activities we can teach them. Daily activities in the sense brushing, eating, dressings, bathing, these type of activities we can teach them. Otherwise, they are dependent lifelong. And in severe conditions, these even daily functioning teaching is also somewhat very difficult.
Okay, sir.
But we have to train them. We have to make them to learn about their daily activities. But whereas coming to ADHD people will not have low intelligence. They are intelligence.
Yes, sir.
Their intelligence is intact. But they have problem inattention. Inattention.
Yes. Yes, sir.
So conditions are both are different.
Okay, sir.
So now we have time for discussion about today's subject. So any student want to interact about this today topic, you can welcome.
Sir,
Please.
ఇది మనకి PTSD ఉంటుంది కదా సార్, పోస్ట్ ట్రామాటిక్ స్ట్రెస్ డిజార్డర్, దాని నుంచి కూడా స్కిజోఫ్రెనియా ఉంటుందా సార్, రీజన్ అవ్వచ్చు?
పోస్ట్ ట్రామాటిక్ స్ట్రెస్ డిజార్డర్,
దాని నుంచి స్కిజోఫ్రెనియా ఎఫెక్ట్ అవ్వచ్చు?
No. Post-traumatic stress disorder is a anxiety disorder, one way. It is anxious disorder because in their earlier life, they got some abnormal conditions they have faced. Okay. So again, those type of fears, those type of conditions they are expecting, they are seeing means they undergo this post-trauma.
వాళ్ళకి hallucinations అవి ఉండవా సార్, delusions?
No. They don't have hallucinations.
Okay. Thanks.
Next. And this mental ill health conditions, you have to spend some time to understand. Just by listening, you can't understand because you need some background information also for this to understand. That is the reason I given to you this neurosis and psychosis definitions. See, directly if I go into schizophrenia, the reality, the topic of reality, you have to understood the difference between neurosis and psychosis. Most of the time, even we are all neurotic. Something happened. We are dull. We are depressed. We are having some anxiety. Definitely, these are all the normal conditions humans will have, no? Even sometimes we are all feeling stress. That time, definitely, our behavior is somewhat not as per expectation. So these are all the neurotic conditions. When you are dull, when you are having depression, you cannot take right steps, no? You cannot be active in your daily functioning.
Yes, sir. But to a certain level, it is normal when we switch back to our daily activities. And
Yes.
psychosis is something they are unaware and they just live with it for
Yeah.
months and days. Okay.
Psychosis is a very serious condition.
Yes, sir.
Sir,
Tell me, Pushpendra.
sir, whatever the topics we discussed, I have seen. Yes.
Whatever the
So
prognosis
whatever
or
the
prospect.
topics we discussed today, so I have seen topics. Can you hear me? Hello, am I audible?
Please tell me.
Hello.
Please tell me,
Okay.
sir.
So the top. Yes. Okay. So whatever the topics we discussed and the disorders we discussed, I have seen the same kind of similar experience.
I'm not audible.
Okay, I'll discuss later. It's fine. I think I have received my audio.
Okay. So you can read your textbook very clearly. All the details are available in your textbook about schizophrenia. This is first part in our mental psychological disorders, and other psychological disorders also there. And next Saturday, we are going to discuss substance-related disorders. See, in mental ill health conditions, schizophrenia only we discussed today. There are so many other conditions.
Yes, sir.
See, bipolar is very serious condition that also. You heard, na? Bipolar?
Yes, sir. Bipolar disorder.
See,
Yes, sir.
bipolar is a condition. Bi means two polars, extreme polars, either this side or north side or west side. Extremes, two extremes, bipolar means. That is called bipolar. The person will have extreme mania or extreme depression. Some days like this, some days like this. The days are not uniform. The manic condition may be 15 days. The depressive conditions may be 2 months. Or sometimes depression may be 15 days and manic may be. The days are not equal. The person's behavior will become very variable. The behavior will have two polars, this polar and that polar. That is called bipolar, two polars. So that is also somewhat serious condition like schizophrenia. So if you are having interest, you can study about bipolar also. But all these things will come in clinical psychology.
Yes, sir.
But we are all studying general psychology now in MSc level. But as per your interest, you can, by reading books, you can have extra knowledge. And next week, next Saturday, we are going to discuss about substance-related disorders. What are the substances?
Alcohol. Drugs, alcohol.
So, but here we didn't discuss about the causes and also treatment in schizophrenia. Yes, sir.
Schizophrenia treatment as a psychologist we cannot provide. By observing the conditions, by observing the patient, if you observe the person is having hallucinations, more delusions, or disorganized thinking, it is better to refer to a psychiatry doctor.
Medication is must.
We can't do anything. It is only our job is referral. Clear, na?
Okay,
A psychologist cannot do any medication, na? So treatment part is not ours.
Yes, sir.
Okay.
Yes, sir. Sir, regarding the exams also, like S.K. Mangal abnormal psychology book you wrote and the textbook which they provided from the university. would these two books would be enough to prepare for the exams, or there's something else we should know?
Which exam?
Final exams, sir. 9th August, they're starting this year.
Okay, your MSc exams.
Yes, sir, MSc exams. We
MSc
got
exams only you prepare with your textbooks, available textbooks. Those are the sufficient. From those books
sir.
only you will get the questions.
Okay, sir.
Out of your textbook, normally university will not go because total information they are providing. See,
Okay,
according to the, in BA psychology, you will get some limited knowledge. In MSc psychology, you will get more knowledge. And if you study further courses, you will get further. You have exposure.
Yes, sir. But in BA, we used to refer 2-3 books and make our
Please
notes.
don't go. Now the time is very limited. You
Exactly.
follow the textbook, you can answer very happily.
Okay, sir. Thank you so much.
So, in exam point of view, do we need to know the treatment? Will questions be asked? It's a silly one, but
No, not silly. You can have, see, you can't give any treatment first thing. So referral is important. And the treatment part also they mentioned in your book. Normally how the treatment will be. It is there, but we can't do it. Just for your understanding, you can read the causes, you can read the treatment plan also. And preventive measures also in your book, they given very clearly some preventive measures also. So you can read in textbook now. We are having another 4 classes only, I think. Correct, na?
yes, sir.
Already
Yes, sir.
4 completed, na?
Yes, sir.
So in the 4 classes, there are very important topics. Another 6 to 7 topics are there. So in next class, I'm saying this is substance related disorders and personality disorders will take more time. And sexual and gender identity disorders also 1 class. Another 3 classes we can complete psychological disorders. Only 4 classes are available further for us. So what I request you, all of you, is not only listening in the class, read your textbooks to have better understanding. Okay?
Okay, sir.
Yes, sir.
So shall we conclude or anybody want to discuss anything?
Done, sir.
Sir, regarding the exam, we have to write the papers like the answers in subtopics or paragraphs or points.
See, follow textbook, amma. See,
Okay.
there are short questions and long questions are there in examination. Short question, you have to write minimum 20-25 lines with matter, with good content, not lines, simply lines. With good content you have to write. Related content, that too. If it is a long answers, long questions, you have to write minimum 60 lines, minimum, with good content. Okay?
Okay, sir. Thank you.
See, your textbooks are very good, amma. I have seen. I prepared from this textbook only. I qualified for MPhil entrance examination with your textbooks only, not by reading any other thing. Our textbooks are very good. Only the thing is we are not following properly. That is the problem. But you have got the examination data?
Yes, sir.
Yes, sir.
For first
From
year?
9th August.
Yes, sir. From 9th August, without gap till 30, including
Without
Saturday.
gap, daily one exam, huh?
Yes,
Yes,
sir.
sir.
Daily on.
Okay. All the best. You please prepare well. Only by
Thank
this
you.
month end, we are going to complete this online classes. So there is a time of July, 30-40 days time is there. You can prepare well. Okay.
Okay, sir. Thank you.
Thank you. We are concluding today class. Thank you very much.
Thank you,
Thank you,
sir.
Thank you.
Thank you.
Thank you, sir. Thank you very much, sir.
Thank you.
Thank you, sir.